पल का हम सभी को इंतजार था। बहुत जल्दी हमारे बीच माननीय गृह और सहकारिता मंत्री आने वाले हैं। ऊपर हॉस्टल में वो आ चुके हैं। अभी कुछ पल और कुछ क्षण में मंदिर में दिया जला के वो नीचे ऑडिटोरियम में आएंगे। बस कुछ पल की बात है, कभी भी हमारे बीच माननीय गृह और सहकारिता मंत्री आ सकते हैं। मंत्री आदरणीय श्री अमित शाह जी, कृपया तालियों की गुनगुनाहट के साथ स्वागत करिए माननीय केंद्रीय गृह और सहकारिता मंत्री आदरणीय श्री अमित शाह जी का, जो अपने दृढ़ संकल्प, प्रगतिशील सोच और राष्ट्रभक्ति के लिए जाने जाते हैं। आपके आगमन से यह सभागार गौरवान्वित हो रहा है। आपके दूरदर्शी नेतृत्व और अद्वितीय प्रबंधन कौशल ने देश की सुरक्षा और विकास को नई ऊंचाइयों तक पहुंचाया है। आपकी उपस्थिति से हम सभी प्रेरित और उत्साहित हैं। आदरणीय श्री अमित शाह जी, जो अपने शक्तिशाली नेतृत्व और दूरदर्शी दृष्टि के प्रसिद्ध हैं, आज हमारे बीच हैं। हम आपका इस अनुपम अवसर पर हार्दिक स्वागत करते हैं। आपका व्यक्तित्व एक शक्ति का स्तंभ है, जो हमेशा देश के विकास के लिए समर्पित रहा है। आपका मार्गदर्शन और नेतृत्व हम सभी के लिए प्रेरणा का स्रोत है। आज का यह अवसर आपकी उपस्थिति से और भी विशेष बन गया है। आदरणीय श्री अमित शाह जी, आपका यहाँ स्वागत करते हुए हम गर्व का अनुभव करते हैं। आपकी सरलता और जन कल्याण के प्रति आपकी निष्ठा ने देश के प्रत्येक नागरिक के मन में आपके प्रति आदर और विश्वास को बढ़ावा दिया है। आज का यह समारोह सिर्फ इस स्तर तक सीमित नहीं है, इसका सीधा प्रसारण देश के विभिन्न शासकीय हॉस्पिटल्स में हो रहा है, जहां हमारे 5000 से अधिक कर्मचारी, उनके परिवार, मित्र और रिश्तेदार इस ऐतिहासिक क्षण को देख रहे हैं। यह कार्यक्रम YouTube पर भी सीधा प्रसारित किया जा रहा है, जिसके माध्यम से अनेक लोग इस अवसर को देख पा रहे हैं। अब मैं अनुरोध करता हूँ डॉक्टर श्रीमती दर्शनी शाह जी से, जो कि शालबी हॉस्पिटल के डेंटल डिपार्टमेंट के डायरेक्टर हैं, कि वह आदरणीय श्री अमित शाह जी का स्वागत करें। डॉक्टर शाह जी से कि वो आदरणीय अमित शाह जी का अभिवादन करें। शालबी हॉस्पिटल का सफर 30 साल पहले सिर्फ 6 बेड के साथ शुरू हुआ था। आज शालबी 16 हॉस्पिटल और 2500 से ज्यादा बेड की अस्पताल श्रृंखला है। शालबी की शुरुआत एक जॉइंट रिप्लेसमेंट हॉस्पिटल के रूप में हुई थी, लेकिन आज यह सभी उन्नत चिकित्सा उपचार जैसे कैंसर, रोबोटिक सर्जरी, लिवर ट्रांसप्लांट, किडनी ट्रांसप्लांट, बोन मैरो ट्रांसप्लांट, डेंटल और कॉस्मेटिक सेवाएं और कई अन्य सुविधाएं प्रदान कर रहा है। शालबी हॉस्पिटल गुजरात और अहमदाबाद की सबसे बड़ी अस्पताल की श्रृंखला है। गुजरात में शालबी पहला हॉस्पिटल था जिसने मेडिकल टूरिज्म में कदम रखा। शालबी हॉस्पिटल सिर्फ गुजरात या भारत तक सीमित नहीं है। मेडिकल टूरिज्म के माध्यम से 16 से अधिक देशों से स्वास्थ्य सुविधा लेने के लिए मरीज शालबी में आते हैं। शालबी हॉस्पिटल गुजरात की प्रगति में अपना योगदान देते हुए गर्व का अनुभव करता है। शालबी हॉस्पिटल में हर श्रेणी के मरीज का इलाज होता है, जिसमें माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी द्वारा शुरू की गई प्रधानमंत्री जन आरोग्य योजना और अन्य सरकारी योजनाओं के तहत भी सेवा प्रदान की जाती है। शालबी हॉस्पिटल शालबी एकेडमी के माध्यम से युवाओं को कौशल और पैरामेडिकल प्रशिक्षण प्रदान कर रहा है, जिसमें अधिकतर ग्रामीण क्षेत्रों के युवा शामिल हैं। हाल ही में शालबी ने गुजरात की कौशल स्किल यूनिवर्सिटी के साथ मिलकर युवाओं को 7 शिक्षा पाठ्यक्रम में प्रशिक्षण देना प्रारंभ किया है, जिसमें एमएससी और बीएससी पाठ्यक्रम भी शामिल है। आज हम यहाँ गुजरात के पहले और भारत के सबसे बड़े बोन बैंक के उद्घाटन के लिए उपस्थित हैं, और यह एक संयोग है कि शालबी के अपने 30 साल की यात्रा पूरी करने पर यह अवसर आया है। यह बोन बैंक नो प्रॉफिट मॉडल पे काम करेगा। भारत में इस प्रकार के कुछ अन्य बोन बैंक्स भी हैं, लेकिन वह अपने स्वयं के उपयोग के लिए काम करते हैं। शालबी का बोन बैंक देश के किसी भी जरूरतमंद को सुविधा प्रदान करेगा। हम गुजरात सरकार के कुशल नेतृत्व का हार्दिक आभार व्यक्त करते हैं, जिन्होंने बोन बैंक के लिए अनुज्ञप्ति को तुरंत स्वीकृति दी और इसकी महत्वता को समझा। यह हमारे लिए एक गर्व का क्षण है कि हमें गुजरात सरकार का समर्थन मिला। अब मैं डॉक्टर श्री विक्रम शाह जी से निवेदन करूंगा कि अपने अमूल्य विचारों से हमें अनुग्रहित करें।
सबसे पहली बात तो ये है कि ये नॉट फॉर प्रॉफिट इनिशिएटिव है शालबी हॉस्पिटल द्वारा, और दूसरी बात यह है कि आप सबने महर्षि गति जी का नाम सुना होगा। साबरमती के तट पे उनका आश्रम है। तो पहला सबसे हड्डियों का दान उन्होंने किया था। सबसे पहले हड्डियों का दान उन्होंने किया था और उसी से वज्र बना और रुद्र नाम के राक्षस का वध किया। ये अपना इतिहास है, पौराणिक इतिहास है। अभी जीवित लोगों को दान करने की जरूरत नहीं है। हम दुनिया में सबसे ज्यादा जॉइंट रिप्लेसमेंट करते हैं, तो उसी में से काफी बोन निकलता है जो हम बाकी के पेशेंटों के लिए यूज कर सकते हैं। अभी भाई ने बताया, उसी तरह इंडिया में एम्स में, टाटा मेमोरियल में, वो लीडिंग इंस्टीट्यूशन में बोन बैंक है, लेकिन वो खुद के लिए यूज करते हैं। आमतौर से नर्सिंग होम्स और छोटी हॉस्पिटलों को बोन नहीं मिलता है। तो होता ये है कि पेशेंट को दूसरी सर्जरी करनी पड़ती है। इलियाक क्रेस्ट से गांठ निकालते हैं या फिब्यूला निकालते हैं, तो एक्स्ट्रा सर्जरी दर्दी को होती है। वो अब सर्जरी का पेन लेना पड़ता है, उससे मोर्बिडिटी बढ़ती है, पेशेंट को ज़्यादा रहना पड़ता है, इन्फेक्शन के चांसेस भी बढ़ते हैं और पेशेंट की रिकवरी भी लेट होती है और खर्चा भी बढ़ता है। ये बोन बैंक की वजह से फायदा सबसे बड़ा ये है कि सर्जरी एक कम हो जाती है और सर्जरी कम होने के बाद वजह से इंश्योरेंस कंपनी को भी फायदा है, पेशेंट को भी पैसे का फायदा है, हॉस्पिटल को फायदा है कि ज़्यादा लोग की ट्रीटमेंट कर सकते हैं। तो इट इज़ वेरी इम्पोर्टेंट कि ये मून बैंक बना तो अपने लोगों के लिए काम आएगा। और सप्लाई चेन के प्रॉब्लम के हिसाब से काफ़ी लोग दूर तक नहीं भेज सकते थे, लेकिन हमने सप्लाई चेन का भी प्रॉब्लम सॉल्व किया है कि हम भारत देश के कोई भी कोने में ये मून भेज सकते हैं। थैंक यू।
अब मैं माननीय गृह और सहकारिता मंत्री आदरणीय श्री अमित शाह जी से अनुरोध करना चाहूँगा कि वह बोन बैंक का उद्घाटन करें। और मैं निवेदन करता हूँ डॉक्टर विक्रम शाह जी, डॉक्टर दर्शन शाह जी, श्री शनय शाह जी, श्रीमती देवांशी शाह जी, डॉक्टर भरत गज्जर जी और डॉक्टर निशा शुक्ला जी से कि वह भी बोन बैंक के अफसर हों। शारकी हॉस्पिटल और यहाँ उपस्थित लोगों की ओर से मैं माननीय गृह और सहकारिता मंत्री आदरणीय श्री अमित शाह जी को हार्दिक धन्यवाद और आभार व्यक्त करना चाहता हूँ। अन्य सभी अतिथियों से मेरा अनुरोध है कि वह अपने स्थान पर ही रहें और यहाँ से उद्घाटन का सीधा प्रसारण देखें। सिक्योरिटी प्रोटोकॉल के तहत जब तक माननीय मंत्री जी उद्घाटन करके ग्राउंड फ्लोर पर नहीं पहुँच जाते, आप सभी से निवेदन है कि कृपया अपने स्थान पर रहें। जैसा कि डॉक्टर विक्रम सर ने बताया, अब हम सीधा प्रसारण देख सकते हैं अपनी स्क्रीन पे सीधे बोन बैंक से, जहां पे आदरणीय गृह और सहकारिता मंत्री जी ने उद्घाटन किया हमारे बोन बैंक का। अब सीधा प्रसारण देख सकते हैं आपकी स्क्रीन पे। At the end of this program, यहाँ उपस्थित सभी गेस्ट के लिए भी हमने एक टूर प्लान किया है आपका, जहाँ पे आप हमारा बोन बैंक और हमारा सिमुलेशन लैब, जहाँ पे सारी ट्रेनिंग्स वगैरह होती हैं, उसका भी एक टूर आपके लिए प्लान किया गया है। सो इस प्रोग्राम के समापन के बाद जब हम इस हॉल से बाहर निकलेंगे तो आप लोग भी बोन बैंक का एक टूर ले सकते हैं, जहाँ पे हमारे जो टेक्नीशियंस हैं वो आपको पूरी जानकारी देंगे बोन बैंक के बारे में कि क्या क्या इस बोन बैंक में होता है, किस तरीके से बोन बैंक काम करता है। तो आप देख सकते हैं स्क्रीन पे मंत्री जी अभी बोन बैंक के अंदर हैं और सारी जानकारी उनको दी जा रही है कि बोन बैंक किस प्रकार से काम करता है। साथ में हमारे चेयरमैन और मैनेजिंग डायरेक्टर डॉक्टर विक्रम आयशा, इस सीधे प्रसारण के बाद जब हम बोन बैंक में जाएंगे उससे पहले हम इस हॉल में बोन बैंक के बारे में थोड़ी जानकारी लेंगे और उस जानकारी को देने के लिए हमारे पास एक एक्सपर्ट हमारे साथ मौजूद हैं जिनका नाम है डॉक्टर लोबो and she has been instrumental in setting up this entire bone bank and her expertise came handy while we were setting up this bone bank. So I would request Dr. Lobo to please come forward and share her expertise and knowledge and tell us more in detail कि किस प्रकार इस bone bank का setup हुआ. She comes with a vast experience, right? In past also इन्होंने bone bank का setup किया है और वही expertise यहाँ भी इस्तेमाल हुई. So I would request Dr. Lobo to please come forward and give us an insight about Shalby's bone bank, that how the entire project was conceptualized और किस प्रकार से हम इसको आगे ले गए, किस प्रकार से सेटअप किया और आज वो दिन आया जब हम इस बोन बैंक का उद्घाटन कर रहे हैं. तो आप देख सकते हैं स्क्रीन पे आदरणीय मंत्री जी बोन बैंक से बाहर निकल रहे हैं उद्घाटन के बाद और एक पूरा टूर लेने के बाद. ग्रुप सेशन फोटोग्राफ्स बोन बैंक के बाहर. So before we proceed for the tour of the bone bank, I would request people to please be seated for another 5 minutes.
Welcome.
Right, so Dr. Lobo, she is with us and हमको डिटेल में जानकारी देंगी कि किस प्रकार से इस बोन बैंक का सेटअप हुआ था. मैडम, over to you.
Good evening, ladies and gentlemen. It's a real pleasure for me to be here today. I'm very happy to be part of the inauguration and also part of the milestone initiative of Shalby hospitals. I've been working very closely with various teams in Shalby, and each of them has played a very crucial role in the setting up of this bank, because there are many aspects to it. And I'd especially like to mention the dedicated team, very small team, the tissue bank team, but they have worked very hard to make this happen. I also feel that Shalby, because it's the largest, India's largest bone bank, and of course we have the dynamic leadership of Dr. SHAH, so I do believe that we are all poised to set the bar for tissue banking in India, and it would be one more proof of vibrant Gujarat. So I wish you all the best. I must say that the field of tissue banking has been a bit slow to take off in India. So the first tissue bank, maybe we can have the lights. So the first tissue bank actually started in the US way back in 1949. So you can see it's been a long time. And there are a number of tissue banks subsequently which have come in US and Europe. And in fact, in the 1990s, there were as many as 300 tissue banks already functioning in USA. But the regulations for tissue banking have taken a long time. And during this time in India, there were a variety of so-called bone banks. Okay, as you can see, those of you who are professionals can see that there were various methods which were used for trying to preserve bone. But none of these were following any standards, and so you can see there was inadequate donor screening, and also this resulted in inadequate clinical results. The first tissue bank in India was started, I started this at Tata Hospital, established it in 1988, and this was the first time that we followed standards. So actually the bank that I started there was based on the standards which were set up by the Asia Pacific Association of Surgical Tissue Banks. Now we have, of course, like I said, since then till now there are very few tissue banks in the country. Dr. SHAH has already mentioned a few of them. And Shalby Tissue Bank is now a new player in the field, and I hope will be a very large one. And as you can see, it's a state-of-the-art tissue bank, and it has been registered. It's now compulsory to be registered under the law. So this is a bone bank which has been registered under the government of Gujarat. Now, like I said initially, there was not much regulation of tissue banks. Mainly there was ear and cornea, which was regulated under the Organs Act. But in 2011, this act was amended and tissues were specifically included. And in this act now, we have the definition of tissue, there's a definition of tissue transplantation, and most important, you even have the definition of what a tissue bank is. So now, as I said, it's mandatory for all tissue banks to be registered. We also have the tissue bank rules, the transplantation of human organs and tissue rules, which are basically for the implementation of the Act. Okay, so everybody asks, what are the tissues that are banned? I think everybody is very familiar with cornea. Most people know about cornea banks, because this started a long time ago. But in addition to that, you have a lot of musculoskeletal tissues, you can have skin, you can have heart valves, all of these can be banned. One tissue donor can restore the health and heal the lives of more than 75 persons. And you can see that in the US, approximately 1.5 billion tissue transplants are performed each year. So India still has a long way to go, and I'm really hoping that the Shalby tissue bank will lead the way in this. Why do we need to bank tissues? Now, of course, the professionals here will already know the answer to this, but there are many people who ask this question, so I just thought I'd roughly go through this. Corneas, of course, can avert blindness. In the case of bones, I'll go into this a little more detail later, but they can prevent amputations, they can help to restore function, and in people who would otherwise be incapacitated or disabled. And of course, tendons can rebuild joints. Then you have reproductive cells, you have veins, and you have a lot of biological tissues, as well, biological dressings, as well as skin, which can ultimately even save lives in the case of very extensively burned patients. Now, an autograft is ideal. An autograft is a bone which is taken from the patient itself and used back in the patient. And Dr. Vikram Shah has already told you the problems that you have. So yes, it's ideal because it's the patient's own tissue. But as Dr. Vikram Shah already said, there are a lot of disadvantages with using these autografts. One is the fact that you are sacrificing normal structure. If you are taking bone from the hip, you are sacrificing that part. Then of course, sometimes you need a long bone, so the long bone which is there in the leg can be taken out, but again, you are sacrificing normal structures. Then what happens is, when you sacrifice this normal structure, very often you get what is known as donor site morbidity. In at least 10% of patients, so for instance, in the hip, there will be pain, there can be nerve damage, and then this pain can last for a lifetime. Sometimes you can get infection, scars can be bad. Then also, if you are taking an autograft, it's a very limited amount of graft because you are sacrificing a normal structure. But in the case of an allograft is the grafts that we produce in our hands. So in the case of the allograft, then you can have an unlimited quantity of graft which can be got. Now, Shalby Hospital particularly is going to be starting the whole cancer section for cancer patients. So one of the things that happens is when you remove these cancers, you get very large segmental defects. And these are extremely difficult to fit. And very often they use artificial prosthesis. But when you have a bone bank, you can use the bone from the bank to help to save these limbs. In the case of children, again, very difficult to get autografts because you don't want to disturb the growth plates. So once again, the bank bone comes in useful. The most important thing about a bone allograft, bank bone, is that it is a permanent solution. So when you use this graft, ultimately it results in the reconstruction, a biological reconstruction of the bone. The body's own bone starts growing and takes over that area. So you have a permanent solution. You may well know that people who use prosthesis, very often the prosthesis wears out, you have to replace it. So none of this will happen when you use a bone allograft. Okay, so where do we get these tissues from? There are two sources, two main sources. One is living donors and the other is deceased donors. Living donors is what we are mainly started now in Krishna Shalby at our Shalby Tissue Bank, where we are, I will show you where we have, for instance, the femoral heads which are removed for certain clinical conditions. And this femoral head, as you can see there, okay, on the left hand side, this femoral head, and that is usually removed and it is replaced with prosthesis. Now normally that would be thrown away. So we say please don't throw it away, send it to the tissue bank, we'll find some way of remodeling it so that it can be reused back in patients. Similarly, in the case of the, if you can see on the lower right hand side, The total knee replacement, once again there, parts of the bone are removed to put in the prosthesis. And that bone instead of being thrown away, I will show you photographs where we can take it to the tissue bank and it can be reused. Okay, in addition, sometimes you can remove ribs, can also be sent. And you've seen the femoral neck fracture and replacement. Okay, now this is how it comes from your OT, the Shalby OT, either the SGOT or the Krishna Shalby OT. And it is taken in these little containers, it goes to the tissue bank. Now this is all to do with the living donors, but you can also get the tissues from deceased donors. For instance, the long bones that you require will usually come only from a deceased donor, although you can sometimes get it from amputated limbs, provided there is no infection. Okay? So you have to retrieve it, there are certain procedures involved. The important thing with the deceased donor is we always look at two things. One is that the body has to always be treated with respect. Okay, so we don't call it a cadaver, we call it the donor, deceased donor. And the second thing is that you always have to maintain the body so that it is in a in a good condition for viewing, for funeral arrangements, etc. Okay, so these are the different kind of bones that you can take from a deceased donor, with much more obviously than the living donor. Like I said, you have to reconstruct the body, so you can. So if you're taking out the long bones of the limbs, for instance, you have to reconstruct it, and you can use sophisticated things like this, but you can also use a simple battle. Okay, it has the advantage that it can be biodegradable both for cremation as well as burials. Okay, now the important thing with tissue, with everybody's fear of using an allograft as a tissue from another donor, is that you're always worried about disease transmission. So that's a very important part of tissue banking, to see that you are not transmitting any disease. And there are various steps that we take to reduce the risks of disease transmission. So the first step is donor screening. So all the donors are screened, all the donors are giving consent. So in Shalby hospital, even though that tissue is actually going into the waste bin, it still is the property of the donor. And so we have to take written consent. So we take written consent of all the donors, and all of them go through the donor screening. Okay, so these are the tests which are routinely done. This is for if you are using a deceased donor. So a deceased donor is usually a healthy adult under 45 years. Okay, so what is the goal? I already told you the first thing is you have to see it's safe, okay, that it will not transmit any disease. The second important thing is that you have to see that it's like any bank. When you go to a bank, you want money and you expect the bank to provide you with that money. So the same thing with a bone bank. When you go to the bone bank, you want to be able to get bone on demand. So that's one of the main things of having a bone bank. So to provide on demand grafts that are safe, of useful, they should be clinically useful and clinically predictable. So predictable in the sense when I know that I'm using this graft, this is the kind of results that I'm going to get. So it's not a hit and miss, you know for sure these are the results that you will get. Like I said, it's important for us to, although we are doing what I will tell you later is terminal sterilization with gamma radiation, it's important for us to reduce the bioburden at every stage. So when you go down to the tissue bank, you will see that whenever people are working, it will be like an OT, a mask, gown, glove, all of that. Plus we separate all our processes. So the wet processing, what we call the dirty area where the tissue first comes in and all the washing happens, is separated from the clean area, which is the dry processing area, where the later stages happen. Okay? So this is all very important. We do environmental monitoring, etc. All of this to reduce the bioburden. Okay, so this is, you already saw this in the video just now, the inauguration. This is the Shalby tissue bank. This is the tissue that's brought in. Then you have various processes that happen. So I said there's a whole processing. So initially it is first stored in the freezer. We have a -80 freezer. After that it goes through processing. The processing is basically to remove blood and bone marrow from the bone, as well as to remove any debris, tissue debris, to remove lipids which are there. So all of this happens during the processing stage. Then the bones are freeze dried. The freeze drying is an important stage because it has a number of advantages. When we freeze dry the bone, it removes 95% of the moisture. So this is basically removing moisture under vacuum and under cold. So the temperature on that freeze dry is -40 degrees. So we remove the moisture, and then it can be stored at room temperature, which is a big advantage. The other advantage of freeze drying is it also reduces antigenicity. I'm sure you all know, of course the medical professionals definitely know, but the others, that when you put a foreign body, you get a reaction. Okay, so this reduces the antigenicity of the graft. So these are some of the advantages of freeze drying. But the disadvantage of freeze drying is that it makes the bone very brittle because you're removing all the moisture. So freeze dried bone is usually used to pack defects. So you will moisturize it, you will pack it into defects, okay? You will not use it when you want mechanical strength. So if you want mechanical strength, then what we do is we do all the processing steps, but the last step, that's the freeze dried step, we don't do. So we keep it in the frozen state, okay? So there we maintain both the mechanical strength, is maintained of the bone, and plus of course it's been cleaned and processed. Okay, so this is just to show you what some clean bone would look like after all the blood and bone marrow is removed. You can see the long bones are there, the struts are there, and that on the upper right hand corner is a femoral head that has come from the, like I told you, if you remember the earlier slide you saw the femur fracture. The femoral head which would have been thrown into the bin has now been cleaned and processed, and it can be reused. Then we do the final packaging. So of course the bones are weighed, so we know what is the quantity because this has to be distributed outside. There's a laminar airflow, that's a biosafety cabinet, I'm sure many of you are familiar with this, where it provides a sterile environment, and inside that sterile environment the packaging takes place. And we always double pack everything because as you know when it goes into the OT you have to have it double packed. So the inner packaging takes place in the biosafety cabinet, the outer packaging takes place, that's a continuous sealer that can take place outside. And on the right you can see we have our own personalized, customized packaging now of the Shalby tissue bank. The upper one is for the femoral heads and the lower one down there is for bone granules, which I will show you shortly. Okay, the last step in this whole process is, like I said, radiation sterilization. This is something that we don't do here in-house. It is sent out to a facility. There's another facility, it's called the Pinnacle Therapeutics facility, which is there in Ahmedabad. And our grafts are sent there. They are radiated with a dose of 25 kg. And the big advantage, there's many advantages to radiation, but the big advantage of radiation is that because its penetration power is so much, we are able to sterilize the tissue after packaging. Now the advantage of that is there's less handling, and with less handling, less chances of contamination. So that's a big advantage of radiation sterilization. Okay, so these are our grafts that we currently have. We soon will have many more grafts, okay? But currently this is what we have, and this is what is obtained from your femoral heads and the tibial cuts that we get. So you have bone blocks, which is obtained from the femoral heads. You can see those corticocancellous chips. That has come from the knee replacement surgeries where bone has been removed and the prosthesis was put in. Then we have morselized. So either of these can be morselized completely, okay, powder. And this is very useful for dental. You saw that earlier we talked about dental implants. So very often the bed where the implant is put needs to be strengthened, okay, and these bone granules are used. So we have two types. We have plain bone granules and you have what we call demineralized bone granules, both of which are used in dental surgery, and they can be used for various kinds. When you extract teeth, and if you need to fill in that sort of void that has been created, you can use these grafts. So these are all very useful, and remember what I said, they are all biological reconstruction takes place. The body's own bone cells grow into these tissues. These tissues after a period of time will disappear and the patient's own bone will be there. So this is a big advantage of having your bone grafts. Okay, so this is, I'll just show you a few slides so that you get an idea of what a difference it makes to patients' lives. This is a dental case here. You can see, and you can see there the arrow showing you where the bone granules are being put, and you can check. See, the last lot is the X-ray, which shows you the growth that has happened on the bone growth which has happened on the right hand side. Okay, this is the dental implant which I talked about, and you can see at the base of that they've added bone grafts. Now these are, like I said, the non-structural, the freeze-dried grafts. So the freeze-dried grafts, what the surgeon normally does in the OT is that these grafts will be mixed with some blood and bone marrow of the patient itself, and this is then injected into, this is then placed into the defect. Now these are some of the defects I think that you see here in Shalby Hospital. You also have a lot of trauma I think here where you can use these non-union fractures where these can be used. These are cancer patients. So this you can see, this is a fibrous dysplasia, and you can see on the right hand side, you can see that the bone has been packed into the defect to show how it can be used. Okay, like I said earlier, when you have cancer patients, you have these huge defects, okay, which are difficult to fill. I just wanted to show you. So this is one which was used in a cancer patient. And normally what they use, I told you, these bones are all frozen. So when they are taken to the OT, they have to be thawed. So we usually thaw them in saline, and usually depending on the preference of the surgeon, they will tend to use an antibiotic along with it. So there's an antibiotic soak, which helps to reduce the risk of infection. Okay, so this is just one case which I thought I'd show you. This is a parastral osteosarcoma. You can see that was an allograft that was taken from the bank. This was when I was in Tata Hospital. I've been there for more than 25 years at the tissue bank there. And this was a bone from our bank, which was used in a cancer patient. That you can see, this was in fact the first time we had used a large bone graft. And ironically, this was a young medical student. She was in her 20s and she was still doing her medical studies when she had come for this grafting. Yes, can I have the video, please? Okay, this is just to show you this young lady after her surgery. You can see how well she's able to walk, and you will also be able to see how well she's able to bend her knee, her foot. And the reason I'm telling you this is that if she did not have this biological reconstruction with this banked bone, she would probably have had to use a prosthesis, which is expensive, number one. Number two, it has a limited shelf life, would probably have to be replaced. Okay, and she would never been able to bend her knees, squat, dance the way she's able to do now. Of course, this is years ago now, maybe more than 15, 20 years now since this was done. Okay, and this is one more case which I'll show you, a little more complicated case, because as you can, so when you have the reconstruction of a bone, it's important to have a good blood supply. Okay, now you can see here, this is a defect where there's no blood supply, it's just a gap. Okay, it's a complete gap. So when you do things like that, then what the surgeons normally do is they will combine it with an autograft. An autograft is a bone which is taken from the patient's own body. So in this case, they took, so this was a young lady, she came to us as a 22-year-old lady, and she had osteogenic sarcoma, and she had been treated elsewhere. And as you can see, they had the nail which had been put, okay, the orthopedic nail, and that broke. And so that's when she came to Tata Hospital, and you can see this is a 26 centimeter gap. So what the surgeons did was, they took the fibula along with the blood supply, and they put it in, they created a window in the allograft which they took from the bone bank, and they pushed the vascularized fibula into that and re-anastomized. They reconnected all the blood vessels. Okay, so in effect, what happened was the allograft gave support to the patient's own fibula bone, which had a good blood supply. So your reconstruction was helped in that way. So here again you can see, this is this woman, as I told you, she came to us as a 22-year-old with cancer. About a year, I think a year and a half after her surgery, she was fine, walking well, she got married, and this is much later, okay, after she had 2 kids. And you can see again what a difference it's made to her life. So just want to tell you that what a vast difference these kind of banked bone will make. There are a lot of advantages to it. This is of course mainly for the medical professionals when they look at it. This is a little boy who had a kyphotic disease because of deformity, because of TB. So you can see that there's a bent spine, and if it was not corrected, the bend would keep increasing over time. So you could see how well they used it. This was done by a spine surgeon, and he used it, and he was able to, you could see the results 2 years after surgery. So what I want to say is, pass on the message. Donate tissues, add life to years and years to life. I say pass on the message because every tissue that is donated, you have to get consent. So it's important for you and your relatives and whoever you talk to promote this message that when you are asked to donate tissue, whether it is during your, as part of a surgical residue, as part of your surgery, or whether it is a relative who's passed away and you're asked to donate tissues, please be generous and do donate tissues because those are ultimately wasted and they are Thank you.
Thank you all. I would like to have some questions from audience. Anybody interested more to know more? ये बहुत हो गए आज के लिए. Yes.
Congratulations, because you mentioned Rishi Datichi.
Yes.
Because most of us and most of young generations, they do not know. The message that you gave was an excellent. This is a suggestion, I am not very sure that we can add that kind of name which can revive your legacy and the vibrations of those were your.
I know.
And that is what I just felt when you were talking. Congratulations again that you mentioned.
Anyone? Yes.
So first of all, many congratulations to the whole Shalby family for initiating this noble cause. My question is like, could there be a difference between a deceased bone and a live bone for tissue bank?
Whether you put a live bone or a deceased bone, it is always refreshed unless it is with the vascularity. So if you take it from iliac crest from patient and put it, it is same as you take it from the deceased. So why to hurt patient more? It costs more morbidity, more chances of infection, more pain and more cost. Anyone else? Yes.
Is there any procedure for the giving the promise to donate the tissues or bones after the death?
See,
Like we do in
see, we are the biggest joint replacement center in the whole world. So we have our own in-house ability to serve almost our country fully. We do 16,000 joints per year. That is number one. Number two is 3,000 in America. So that is the huge difference between us and anybody else globally. So we retrieve lot of graft which we can process and give it to others. Having said this, if you need a larger graft, whole lower end of femur, whole upper end of femur, tibia, you need larger graft, then you have to take it from a person who is doing liver transplant, or after brain dead person gives more liver, kidney, we can take the larger part of bone that can be used.
how will be the chain to distribute the required
Freeze-dried bone has a shelf life of 3 years, so it can be kept by doctors or for a supplier. Hospital can keep it with them for 3 years, and they can use it for 3 years.
Thank you.
Anybody else? So thank you very much all of you to come all the way to Krishna Shalby. Many people might not have seen it at all. So this was a chance to see the hospital, that such a beautiful structure is this. And there is a light refreshment, so please have it before you go. I will join you there. Thank you.
Thank you everyone. So there's a visit plan, right? So as you step out of the auditorium, you can take a round of our bone bank, followed by our simulation lab, which is just adjacent to the tissue bank, and then there's a light refreshment outside our simulation lab. Thank you everyone. Thank you once again.
wanted something? So, I think medical? No. This is our bone. This is our hip. This is a hip joint. And knee and then this is tibia. એટલે વિક્રમ સર સર્જરી કરે છે knee નહીં કરે એટલે we cut this bone and put an implant like this because of the same right એટલે એને કાપીને યુનિફોર્મ કરીને અહીંયા implant મૂકે hip jointમાં bone cutting fixation થાય so we get these bones from each and every patient so a lot of bone with us so we thought just to throw it away or not use it let us very so now this bone which comes from operation theatre and we need to follow
Channel 1, channel 1 ચાલુ છે.
It becomes like this. Okay. Then it is given a shape, for the machine. If it is a big bone, then it goes to the cutter. If it is a small bone, then with this they give a shape like this. And if it is a big bone, then it goes in this cutter. This is a bone cutter. So it gets cut this way. After cutting this, it will go in this machine. It's a 60-degree temperature where it's a shaking machine. So it will be shaped, it will go for 3 hours. It will continuously shake for 3 hours and then the bone is washed. So there are HIV pores. The bone, if you have some infection or something, this machine will get started. So 3 hours it's a drawing machine. And here, again it is a machine with a caliper. So after doing this, the bone will be seen like this. So it's clean, right? And they have already shaped it. So it is clean. Then again it is clean with distilled water. Then it goes in a storage. It goes for radiation outside the hospital. We don't do radiation there. So we have time of it. So they take a batch of 60. So 15 batch of this and 15 batch of that. They prepare and then send it to the radiation. Till that the bone is stored in this minus 80 degree temperature. Then it goes for radiation. After radiation, it is stored here and then directly dispatched. Minus 80. So that is for wet technique, where it goes in radiation and it is wet. Then again that sterilized bone is done dry over it. There are two methods. Wet you need a bone to transfer the bone. It is clean and it is dry as a common powder. Dry form of the bone. So एक batch ready होकर बैठता है इसमें होता है दूसरा batch will come here and it will go in that it's dry machine where 95% of moisture from the bone is removed at the machine. So it works for I think 22 hours. So it works for 22 hours. Then the moisture goes out of the bone. So when the moisture goes out, they are like this type of bones. Okay. Then this is a moisture testing machine where the moisture is tested. This is a weighing machine. A weighing machine just to weigh and that is a grinder for dental. The bone is grinded and the dental in your bone, the dentist use this powder to fill your tooth, the loss and everything, crack in the then it goes in this radiation machine. It is radiation machine. It is packed here. So it is packed. The one pack is done. The double pack. One pack is done, and then that machine does the second pack. Then they come in this form. This is a final form, and this is what we give to the patient to dispatch it this way. So it is in powder form or in a they go with a batch number because it's like a organ donation thing. So a lot of ethical things are there. Consent form of the patient, the measurement, the infection, the blood reports, all are attached, and then it is.
Dr. Shukla, how does one decide to become a donor? Is it like an organ donor card or has to sign a 401?
Donor in the sense, see, we have a lot of orthopedic surgeries, right? We are highest in replacement. So as such, उनके bone को cut करके right. So we just take a consent. Okay, do you want to throw it or do you want it to be used? So if they give a consent, then this whole procedure starts.
That's the existing supply chain, for example, the food supply chain. When someone wants to become a donor,
So then we came up with this because that seems difficult. This can be transported between the hospitals, okay? Because you cannot manage that jail. But we are trying to do that. Because we have 12 hospitals, so one patients need it. But it's difficult, but this is a good, it's a shelf life is very long. You can lie in your, clinics, in your it's very difficult, minus 81 તમારે મેનેજ કરીને લઈ જવું અને થોડું બી જો 60 કે 50 પર બી જાય ને તો it's not અને મેડમે બતાવ્યું ને જે આપણે બોન હતું પીસ હતું એ બી આ બધા પ્રોસેસમાં જાય જ હવે એમનું પછી જો આ બધામાં બહુ જ પેલું કટ થાય તો તમારે આ કરવું જ પડે બટ ઇટ કેન બી ઇન ધ સેમ હોસ્પિટલ સી કૃષ્ણા આઈ કેન ગિવ ધીસ બેડ ક્રાફ્ટ યુઝ અવર બેડ ક્રાફ્ટ પણ બહાર તો આ જ કરવું પડે એમાં તો રિસર્ચ વિરાટ ગમે રિસર્ચ વિરાટ ગમે ઓન્કો મેડિસિન તમે હવે આઈડિયા
અમારા કામનો એ જ આઈડિયા છે આ બોલ તમારું કામ ના લાગે
but sir, it's the first comprehensive road map of Gujarat. And market wise highest in India.
બધા ટીશ્યુ કરવાના
Tissue application કઈ છે? Yes, sir, we have that all material. We just throw it away. We have biomedical waste like nothing more. One by one get this. Now this is what should I say? No, it's not mandatory. It's not mandatory. But we have it and we are doing it. So they actually they have a shortage of boats. See, we are a hospital. Because वो कहाँ दूसरे से see everybody is not going to send their home to some place because again transport, storage is a big thing, right? We have our own supply of boats.
So it's the strength of this hospital which is being leveraged.
Yeah, and see, Tata is only able to supply their own patients because of shortage of them. We can supply to anybody else. We have a good policy.
This will be helpful for like someone has a fracture then these
Any bone graft or whatever you want. Fractures है, injuries है, onco में अगर आप लोग osteoporosis है,
what's surprising is the vascularity has to be there. However, that being said, you can take on life mode, you're doing like industrial hardcore industrial processes on the bone. दोनों विचार थोड़ा vascular में 10-15 मिनट 2 घंटा रुक गया.
वो जो है ना ड्राई है ना ज़्यादा डेंटल और उसमें यूज होता है. This bone wet will be going more in patients like surgery, big surgeries, पूरी bone की surgery, बड़ा piece.
Okay, so you before.
Yes, it's changing from Ahmedabad.
Yes, that's it.
Thank you.